Hello, everybody. Greetings from Dr. Rishikesh Pandya. Uh, I hope the world is safe. All of you are safe and healthy in this COVID times. And at this point of time, considering the meeting that we are in, I am glad that I am going to speak on the opportunity in this opportunity to speak on the 7.5 French flexible ureteroscope. As you see, the title is Thin Scope Wide Access. It is very self-explanatory, and we have all used 9 French scopes earlier, and let us see how 7.5 in my hands. So this is a case of 34-year-old gentleman who presented with right renal colic. His stone size approximately being in 2 dimensions, 3.5 centimeters by 2.5 centimeters, predominantly being the renal pelvic stone. So this is the image seen on the fluoroscope just prior to the surgery. And there are small lower calaicial satellite stones as well. And as you see, as we move ahead in the surgery, we have got a significant and a good clearance at the end of the procedure, which if you see here, it is 8:40 time, and here it is 10:24. So it is roughly around 1 hour, 40 minutes, which we took to complete the stone. And so this was not a pre-stented patient. The first surgery was done on 10 February 2021. The surgical time, a little more than 90 minutes. Laser time was 16 minutes. I do optical dilatation for these patients by using rigid ureteroscopes, 6 French followed by 8, 9.8 French. So I can get an access of 12 to 14 access sheath. Obviously, the scope here used was 7.5 French PUSEN flexible ureteroscope. I use the dusting mode, as you can see here. This is the screen of the Quanta laser, and I could achieve a significant amount of clearance in the very first attempt. This is a more close-up view of the fluoroscope pre-op, and this being the post-op during the insertion of the stent. And as you can see, there is some dusty material which might be residual of nature and pending to come out maybe around stent. So 29 days post-operatively, when the check X-ray was done, this patient had that dusty material collected in the mid-ureter in the form of a Steinstrass, as I am pointing it out on the with the arrow. So 33 days later, that is few days after this X-ray, second stage procedure was done. Rigid ureteroscopy was done. The time taken was 20 minutes. Laser was 4 minutes. Complete stone extraction, Steinstrass was removed with basket and washes, and complete stone clearance was achieved, and a restenting was done. After the second procedure, patient went to the home country, which was India, and on return, we did a fresh X-ray as seen on the left side. That was 46th day after the second stage procedure. The timings I am mentioning specifically because we learned something out of it, especially for little larger stones. So as you see, there is no residual stone or no residual stone material. So on 52nd day after the second stage procedure, DJ stent removal using flexible cystoscope was done on OPD basis under local anesthesia. So certain comments and certain points why the thin scope, wide access, and all this modern technology has improved is because 7.5 scope, the thin scope, 12 by 14 sheath, the wide sheath. So why cannot it compete effectively with the ultra mini or micro PCNL? I'm sure very soon the world of urology will favor this access as compared to the micro PCNL or ultra mini PCNL, where the instruments are very fragile. So in this case, the patient had 2 procedures which were daycare procedures, one outpatient procedure for the DJ removal, and time away from work was just 3 days. Complete stone clearance was achieved almost for a partial stag on. First procedure, as I said, little more than 90 minutes. Second procedure, actually a little less than 20 minutes. So thin scope, wide access. So small scope, wide access, you need good laser, you need good irrigation so that the dust and the material can be washed out simultaneously. That is the idea of having the thin scope and the wide access. So the intrarenal pressures remain low. And there is no harm leaving the stent for longer time. This is what we learned from this patient going to the home country, coming back a little late, and he was comfortable. He had his personal life back home. So there is no harm keeping the stent for a longer time. It makes sense in such kind of larger stones. So, and definitely we should be counseling the patient for multi-stage procedures for clearance. So I'm sure at the end of this small presentation about the case, uh, thin scope, wide access is the new way to go. And I'm glad that PUSEN is providing us the 7.5 small thin scope. Thank you very much for the patient listening. Have a healthy, safe life.